We have 17,238 confirmed aggregate cases of coronavirus in Victoria. That's 222 new cases since our update yesterday. I'm saddened to have to update you that there are now 334 Victorians who have passed away as a result of this global pandemic. That's an increase of 17 since yesterday. Of course, our thoughts and best wishes, our prayers are with the families of those 17 Victorians. This will be an incredibly difficult time for them, and we send our best wishes to them. By way of detail, I can confirm one male in their 60s, one female and one male in their 70s, two females and four males in their 80s, four females and four males in their 90s. 13 of those 17 are linked to aged care outbreaks. There are 665 Victorians who are in hospital. 45 of those are in intensive care and 32 of those 45 are on a ventilator. A total of 1,992,725 tests have been received. That's 17,695 test results that have been processed since yesterday, and I'll come back to testing in just a moment. There are 3,669 cases with an unknown source, an increase of 43 since yesterday's report. There are some 1,036 healthcare workers who are active cases. There are 2,024 active cases in aged care settings and a total of 7,274 active cases across the state. Just a couple of other updates. Pleasingly, regional Victorian numbers continue to come down. 422 active cases are now in those regional local government areas that are the subject of stage 3 restrictions. To give you a breakdown, with those three large regional cities that we have been concerned about, Geelong is at 159 active cases, Greater Bendigo 44 and Ballarat at 24. So they're relatively stable, but in aggregate terms, the total number of regional Victorian cases are down. I think the best part of about 90 cases in the last 4 or 5 days. So that is good news, but I would just say to all regional Victorians, and perhaps this is the best time to make the point about testing, if you look at testing results, and this is not surprising given the amount of movement that has been curtailed, the amount of movement that's simply not happening, then it's not surprising that total test numbers day on day, if you compare, say, this week with a fortnight ago or this week with last week, are down. To give you a sense of that, in the 7 days from the 11th to the 17th of August, we saw 154,500, call it 155,000 tests that were processed. That's about 30,000 less than we had done for the previous week. So that's about 17% less testing. Now, that is, I think, almost certainly the product of people not necessarily moving around the community anywhere near as much. And whilst we don't want to be promoting movement, because curtailing movement is all about driving those numbers down, I suppose our principal ask of Victorians today, the principal request, is that if you've got any symptoms whatsoever, as soon as you have onset of those symptoms, as soon as you first notice those symptoms, please come forward to one of the more than 190 test sites across the state. Get tested. Don't wait a day, don't wait 2 days. Don't wait for your symptoms to get worse. That can be a time where you're very, very infectious. And what I'm trying to avoid here, what we're all trying to avoid here, is that case numbers come down to a point where we start to think about opening up and what that will look like, only to be unable to do that because the test numbers are too low for us to have clarity about just how much virus is out there. It seems logical that there would be less testing, but not this much less. So I'm really asking, I know we're asking a lot of Victorians at the moment, but if I can just simply say to each and every Victorian, if you've got any symptoms at all, please come forward and get tested. We will get your results back to you as quickly as possible. The lab teams are working very, very hard. It's a big, important, powerful contribution that you can make to our collective fight against this enemy. As I said, I don't want a situation where we see numbers continuing to fall, but at the same time, the total number of tests falling also, because then that will mean we don't have confidence that we have an accurate picture of just how much virus is in the community. We don't want that to be in any way an inhibitor to moving to a new phase and a new set of rules. But we've got to have that confidence that we are getting a complete, or as close to a complete picture as we possibly can. More test results, obviously, are much better than less. It's not surprising in some ways, given the amount of movement that just isn't happening. That's really important, critical in fact. But again, I would just ask every single Victorian, no matter where you live, if you have any symptoms, please come forward and get tested. Stay at home till you get your test result. We'll do our level best to get that result to you as fast as we possibly can. And that data will help us to make the very best decisions, because we'll have that confidence that the numbers we're seeing in terms of positive cases are from such a significant sample of testing that we've got a good and complete picture of how much virus is out there across Victoria. Simple, but a really powerful contribution that each and every Victorian who gets tested can make. Just to round out updates in terms of data, I spoke about regional metro split. In terms of aged care outbreaks, as at the 18th of August, total numbers since 1 January, 3,240, 2,024 are currently active cases connected to aged care. Total number of aged care outbreaks, again, since the 1st of January is 150, of which 120 are currently active, and the total number of people who've passed away is, my notes tell me, 230. Again, we'll continue to update those on a regular basis. So 224 active cases currently. So aged care remains a significant challenge to us, and that's why everybody's working together as closely as they possibly can, doing many, many jobs that people would not reasonably be expected to do.